I'd like to welcome everybody this evening to Nursing Informatics Research, 2 years in review. And we are just thrilled tonight to have Dr. Andrew Phillips, who I'll refer to as Andy from now on. Before I get going, I want to assure everybody that there are no conflicts of interest and there has been no commercial support for this program. But I'd like to start by giving a little bio for Dr. Phillips. Andy Phillips is an associate professor at the MGH Institute of Health Professions and a faculty nurse scientist at Mass General Hospital. Dr. Phillips serves as the director of nursing research at Spalding Rehab Network, working with nursing staff on clinical improvement, most recently the impact of hand hygiene technology on compliance, hospital-acquired infections, and contact tracing during the COVID pandemic. Dr. Phillips received his PhD in Nursing Informatics and his BS in Nursing from Columbia University School of Nursing. He also holds a BA in Economics from Washington University in St. Louis. He has also worked as a staff nurse in the Pediatric Intensive Care Unit at Westchester Medical Center in New York. He was a predoctoral trainee at the Center for Evidence-Based Practice in the Underserved at Columbia University School of Nursing and a co-investigator in the Health Information Technology Collaborative at Weill Cornell Medical College, examining the early stages of health information exchange. Later, as a policy advisor, Dr. Phillips examined the application of federal mandates around qualified health information technology on the specific legislation and regulations needed to ensure health data security, compliance, and feasibility within a statewide health information exchange. And to add to this lengthy list of accomplishments, he is the president-elect of NENIC. And we are very glad and would like to give him a warm welcome. And I'm so grateful for his presentation this evening in advance. I'll ask everybody if you want to hold your questions to the end. It will probably help us get through his presentation quickly. But you can always put them in the chat and we will look at them and we can always facilitate them if something he says triggers a thought or an area that you would like to explore. Feel free to jot them down in the chat. And with no further ado, I'd like to turn it over to Dr. Phillips.
Can I also ask people to mute themselves if you're not Andy too, please? Thank you.
Well, thank you, everyone. I missed our in-person events. So Mary was kind enough to ask me to see if I could pull this together over a 2-year period instead of just the normal one. And I said yes, because I enjoy doing this every year. And this will be the output from all that labor of love that you will notice when we go through it. So I will say the same things that Mary did, which is, oops, it's not moving. There we go. This is me. I have no conflicts of interest to report, which I think Mary said as well. And these are the learning objectives for this evening. We're going to look at the literature, nursing informatics literature over the last 2 years. We're going to I'm going to talk about some of the themes that came up as I was reviewing that literature and its impact on nursing informatics. I'm going to look at gaps in the nursing informatics literature and generate logical next steps in advancing nursing informatics research. So those are the learning objectives for tonight. The methods for the review, I've applied a scoping review methodology to this work. This is something that was added when I first started doing this back in, I think I started this in 2017, started giving these talks. So back in 2017, I converted this to a scoping methodology so we could get a nice broad picture of nursing informatics. So the methodology adopted is one that's well known. It's by Arsky and O'Malley, and involves 6 steps. Step 1 is the identification of the research question, which we just talked about a little bit. Identify relevant studies. That's the literature review piece. Study selection, some iterative process, which can change over time. So as I go through it, I'll talk to you about what I did. Charting the data, so cataloging it, getting some handle on what it's there as far as kind of high level. and then collating, summarizing, reporting the results. This is where we start identifying some of the themes and outcomes from it. And then consultation, that's the last piece, which is part of the scoping methodology, is that you go out to experts and get their opinion too, or their reactions to what you did, because that ultimately strengthens the output from the scoping study. So I'm going to hopefully get some input from you as we get toward the end of this, and see whether you agree with the theme, see whether there's things that you would add, see what kinds of questions you have with regard to the presentation tonight. So the research question, step one, is what trends and themes emerge from a survey of the published literature in the area of nursing informatics during the past, in this case, 2 years. Make meaning of those current and past themes, and also look at it from an historical context. So I've been doing this since 2017, and I've been keeping track of the themes that I've identified over those years. So I'm going to try to pull back on some of those prior themes and highlight where I think things are moving or changing. So step two is identify relevant studies. The search strategy was I looked at the PubMed and CINAHL databases, and the search terms are, excuse me, below, which is nurse or nursing and informatics. There's an asterisk there, so I can get it with or without an S or some other way that it was spelled, or just nursing informatics. And I looked at publications from March 1, 2019 to February 28, 2021. And that time period is selected because those are the years that I've looked at consistently over time, that March 1 to February 28 time period. I was also going to be giving this talk a little earlier in the year. So I could have, I guess, expanded this a little bit and done something through September, but I think that I will save that for our next in-person. So I'll have a good collection of information for our next in-person, which I hope is coming up in April. And nothing prevents that from happening. Step three in the methodology is looking at inclusion and exclusion criteria. So the inclusion criteria for the scoping study were research, has to be research, contributes to nursing informatics knowledge base, either a prototype development, testing, clinical care delivery focus, or informatics. The exclusions were articles focused on informatics, education, something that's not research, I didn't write that there, nursing education, and nursing students. Here are the search results for 2020 and 2021. So for 2020, there are approximately 1,000 and change articles that came up from the search. There were 93 duplicates. I had wished there were more. There were only 93. So I looked at 963 abstracts for 2020. 652 did not meet the inclusion criteria, leaving 311 where 65 I wasn't able to retrieve, or after looking at the full text didn't meet the criteria. So 276 full articles were reviewed for this presentation for 2020. In 2021, there was a little more kind. We had 718 articles, 2 duplicates, and by the end of the day, there were 179 articles for full text review and included in this scoping review. And here's just the same information on a graph. And I'm hoping that trend kind of stays there and doesn't go back up again, because that 189, 179 is a good number to go through. It gives you a good flavor of what's going on. So charting the data. So this is where all of the articles came from. You can see that it's a nice broad cross section of the world here. The US is the majority of where the articles come from, but there is a scattering of articles throughout the rest of the world. And on the next graph, I'll kind of show you some of the trends I see in where we're seeing more of the nursing research and nursing informatics research. So one of the areas that I wanted to highlight is kind of this Korea and the Middle East. We're seeing a lot more articles coming from there, especially the Middle East. And these are raw numbers, so these aren't percentages. I had originally in past years, I had done a percentage, but the USA being such a big percentage, it kind of skews some of the other figures here. So I thought So when I was looking at it this way and just looking at the raw numbers, I think you get a better picture of what's out there. And if you look at the Middle East, it's producing that at this point the same number, at least of articles, as Sweden, Taiwan, and in this last year the UK. So the Middle East and the UK had the same number of articles produced that came up in this SOAPing review. So it's nice to see kind of a broader selection of countries involved in nursing informatics research. I also look each year at setting, and I'm not sure there's a lot here. It's kind of a busy slide, and I'll look at it in a different way in a sec. But kind of the thing that kind of jumps out at me is it really hasn't changed from year to year. Hospitals are still a big thing of it. Long-term care is another big setting. One of the things that I did add this year is this category of literature review, which is in blue. I don't know if can you see my mouse? Someone nod. You can see my mouse moving around. No. Yes. Okay. I see a yes. Okay. So this blue pie wedge here is literature review, and one of the themes that emerged is that there are a lot of literature reviews all of a sudden in this data. And I don't know what to make of it yet. My kind of joke offhand is that, gee, if we just do literature reviews, eventually we're going to have to do studies so that we can do more literature reviews. But there were a lot of literature reviews out there in these 2 years. The other thing that's different, at least in these two charts, is this category of health professional expert, this yellow pie thing, where it's non-existent in 1920. This is either a reflection of my coding, meaning when I went through and coded all those articles, I interpret it maybe differently between one year and the next. But I think the real issue is that I saw a lot more literature dealing with where the setting was not a hospital, but the setting was sitting down with a set of expert panels. And I'll show you one example of what I mean by sitting down with a set of expert panels. Now the expert panels may be within a hospital, but I started to segregate those and thought it needed its own emphasis. And here's just another way of looking at it. This ambulatory outpatient, community public health, continuum of care, these categories are kind of melding together over time. And I can sense that when I do this myself, that I'm not as consistent potentially between those two things. You can see the continuum of care has kind of dropped precipitously over the 3 years shown here. And the other ones are kind of staying the same. But if you look at them all together, those three areas are generally staying about the same. The thing that's increasing is this area of long-term care, which makes a certain amount of sense with the aging population. And one of the things that I'll talk about in themes is that this long-term care, one of the things we're seeing in the literature is this melding now of these mobile health apps and other kinds of e-health technologies to support the aging population. So that's something we didn't see, or life didn't see in the past, but I'm now seeing more of the literature trying to meld those two things together and look at technology acceptance in elderly populations, in long-term care settings or other kinds of settings. So it's certainly not limited to just long-term care, but we're seeing more literature focused on that setting. And then again, I had talked before about this category that I added just because I kept seeing it over and over and over again of literature review. So no particular setting as far as the research, but the research was literature review as opposed to some other kind of research. Topics, another busy graph. A lot of this is hard to show graphically, but the inner circle is 2019, 2020, and the outer circle is the more recent year, the 2020-21. The things I'd highlight here are public health, which went from 2% to 10% between I'm going to get tired saying these words here, 2019 and 2020 and 2020 and 21. So that's another theme that's gone on, is that we're seeing a lot more articles and studies around public health, and in particular health disparities. So health disparities research is growing, as shown here in this chart. Another area that's changing is social media. Social media is starting to be, I'm seeing a lot more social media focused articles dealing with Facebook, Twitter, those kinds of services and platforms. COVID is now there. I think we all expect that. That's not a surprise. And we were starting to see that in the 2020, 2021 literature. I expect when I look at 2021, 2022, that's going to be a much bigger piece of the pie. We're just looking at here, we're only looking at some of the beginning of it, and it takes a little bit for things to get published. But this is kind of the first wave of the COVID literature that we're seeing. And then the last piece is this pink piece, which is visualizations. So visualizations are how people, it's almost like it's a somewhat human computer interaction where we're evaluating screens and how people look at things and how data is visualized and interpreted. There was a lot of research in the 2019-2020 period dealing with visualizations of data. I did not see that same level of research in the 2020-21 period. And it may just be what came up from the searches, because I imagine it's still being done, but it wasn't in the literature. It just disappeared off the literature that I reviewed. This is just another way of looking at it. There's nothing new or surprising here. One of the areas that we might focus on is this mobile e-health texting area here, where there's only 2 bars, and then telehealth, and it got merged. So the kind of the line between telehealth and mobile e-health, those categories as they were defined and interpreted over time are kind of merging. So if you were going to look at this, you'd want to look at these as somewhat together as a combined chart. And I can try to do something more on that next year. Again, clinical documentation, big data, decision support, it's staying relatively the same. Here's that visualizations that I had just talked about. And then here's the public health growing for the most recent year. All right, cruising along here. So step 5 is looking at the results and identifying some themes. And I have some representative articles as well. So for 2019-2020, these are the themes that I identified in the literature. So one big one was population health and population disparities. This is, if you look at the Future of Nursing 2020-2030 report, disparities is a prime focus of that. And that's certainly reflective of the literature in 2019 and 2020 and continuing into 2020, 2021. And I imagine it will continue to increase over time. So some of the things that were talked about in this first year of the study was telehealth technology to address health equity. So how can we use informatics and in many of the articles, telehealth specifically, to address health equities? And I have an example of that in the articles I'm going to go over. And then mobile health apps for patient behavioral change. So I put this under population health as we're looking at populations. How do we address diabetes, which is a huge public health issue? There are mobile apps that people are looking at to try to address patient behaviors and behavioral change. So to me, that was another population health topic that made sense to put there. Let's see here. The next one should be no surprise, documentation burden. Starting in 2019, started to see a lot more on documentation burden, and even more specifically on the importance of the nursing note and the implications of the data that's contained in it. Because of the uniqueness in many cases of how those nursing notes are captured, there is a lot of research on how do we extract key information from the nursing note to better provide a picture of the patient's health or patient's status. And then that also related to documentation burden, and those are somewhat intertwined. So we have this importance of the nursing note and importance on the data that's being recorded by nurses. And then there's issues around, if you're recording that, what kind of burden, what kind of stress, what kind of cognitive load is this putting on nursing as a result of the activities that are being put on the nurse. Older populations, I mentioned that earlier, older populations are growing as far as the research and the emphasis and discussions and settings around older populations. I put this twice, I guess, aging adults, same thing. And then patient-directed technology, so social media versus e-health, and this kind of need to research information needs. So one of the things is that individuals go out to these various social media sites to get health information. You know, most recently, there's been a lot of talk about information around vaccines and things like that. But there's research starting back in 2019 and before about how we use, and again, when I looked at the topics, the social media topic started having a little piece really in 2019, 2020. It was not really a high level theme in the prior year, but it's becoming a larger theme as we move forward. And as more people are getting information from that. I didn't include this in the list of articles I was going to review, but there was one article that talked about how much information comes from bots within, I think they use Twitter bots, how much information came from Twitter bots versus actual real people putting information out there. And I guess the good news from that study was that most of the information that people gathered from social media came from non-bot sources. But this whole concept of social media and e-health is important. Text messages, how we use text messaging to convey information. Information needs and visualization. I talked about visualization being a big theme in 2019, 2020. And this directly relating to information needs of the patients or individuals. So if you are a diabetic, how do you get information about your care? How do you get information about trends in your health? Those kinds of things. Patient-generated data, wearables, smartwatches, patient-reported outcome measures, those kinds of things where patients are generating their own data and how that data is used and interpreted. Machine learning, artificial intelligence continues to be a big area in the informatics literature, largely around predictive modeling. But when we get to 2020, 21, I believe, we'll start seeing a lot more of the machine learning trying to pull out specific information. So in that idea of trying to interpret nursing notes to be still predictive, but how do we pull information out of existing text? So that's that second bullet there, the artificial intelligence, machine learning, and this kind of clinical documentation. How do we get information out of there? And then this what I call this interconnected use of big data to evaluate diseases and develop interventions and patient tools. Patient technology acceptance is still an issue. So there's still a lot of literature around the acceptance of technology. So we are continuing to address and look at how technology accepted, and this is both at the patient and clinician level. I'm joking a little bit here. I saw a note that literature review is part of the research. I agree, but there was just a lot of it, and it was just something I picked up. And then school nurses, there was a lot of literature around school nursing and issues around school nursing. I think from a policy perspective with COVID, I think school nursing is becoming a big issue as well. And it'd be interesting to see in 2020, 2021 and 2022, whether any of that literature rises to the surface around school nursing and the cognitive and workloads of school nurses, given the pandemic and all the things they need to do around that. So I have I should have put this at the end, but these are the citations, some representative articles that I'm going to go through right now. So first one is an article by, not going to pronounce it right, but Gopalan et al. Is the use of financial incentives and text message feedback to increase healthy food purchases in a grocery store cashback program, a randomized controlled trial. So the authors in this study took a healthy food program that offered 25% cash back if you bought healthy food. And they took that program and stratified it into a combination of incentives. I think there were 6 different categorizations of that. So the members could get a 10% cashback amount. They could get a 10% cashback amount that was conditional on what they purchased. They could get a 10% cashback amount automatically based on some other level of criteria. They had mixtures of 10% and then another 15% based on the types of purchases they made, but the financial incentives varied in various things. And then they also mixed in there various kinds of text messaging as well to remind people about the program. So there were general text messages and then specific text messages around their prior purchasing behavior. So reminders saying, hey, when you were at the food store last time you purchased X, could you consider something else? So they had those 2 different kinds of text messaging as well. So I think the combination of the levels of reimbursement and the level of text messaging came up with 6 different, they're calling arms of the study. The conclusion was interesting in that none of the tested financial incentives or text strategies affected food purchasing behavior. So this goes to the fact that it is still very hard to change patient behaviors. And this is something that's known. And I think a lot of people are continuing to try to use technologies and the new technologies and tools we have in front of us to try to influence patient behavior. And this particular strategy, they didn't show any change in behavior as a result of cash to try to change behavior. Next article is by King et al. And these authors looked at documentation and nursing notes as predictors of patient risk of deterioration. And while it doesn't say artificial intelligence in here anywhere, one of the things that you need to do to kind of improve how you gather information from patient notes is you need to start figuring out how to code it. Systems love codes, as we all know. And just taking text and not putting some classification around it or some kind of ontology around it. If you can do that, you can get much more rich information out of it. I'm probably speaking to the choir here, but that was the premise behind this study. So they took identified through meetings with subject matter experts. And you remember I talked about the expert panels as a category. This would be an example of an expert panel where you have subject matter experts who are the source of the data and the information rather than some other things. So I put this setting, and I could put studies in more than one setting. So this was in a setting of expert panels. It was also in the setting of hospitalization. So these subject matter experts were asked to identify classifications that would be predictive of patient risk of deterioration. And they came up with a list of 29 concepts around patient risk of deterioration. From these, they had 111 entities, which are the next layer down, and then 586 seed terms, which were the smallest smallest granular aspect of each of those concepts. And the conclusion was the fundamental lexicon offers more granular terms that can be identified and processed in an automatic fashion. So again, when we start looking at automated fashion, we start thinking of ways that we can, on a more automated basis, start pulling data out of nursing notes. This is an example of the lexicon. You may not be able to read it. So the concept in this particular example is cardiovascular alteration. The entity level is tachycardia and bradycardia. And then the C terms is high heart rate, tachy, HR high, slow heart rate, Brady, and low heart rate. So these are the terms that you'd be looking for in the nursing note that would then track to cardiovascular alteration. This other chart is looking at, they looked at these categories in terms of ICU and non-ICU settings. So they built this around an ICU and non-ICU sentence to get a more broader list of terms. And these are the differences in priority for patient deterioration in these two areas. So for example, activity was looked at solely in the non-ICU environment, whereas bowel and gastric information was looked at more so in the ICU category as a predictor of patient deterioration. The next study, I'm picking all these studies and names I can't pronounce, but Kairat. The title here is Advancing Health Equity and Access Using Telemedicine, a Geospatial Assessment. And this is looking at health disparities and health equity and the use of telehealth. In this case, they looked at the impact of a virtual urgent care program that was established in, I believe, 2016. I could be wrong, but I think it was 2016 in North Carolina. And they studied the virtual urgent care program at the time of the study had 5,343 patient activations. And they defined a patient activation who was someone who had enrolled in the program. They didn't necessarily have to have used it, but they did need to be enrolled in the program. So these are the enrollments, if you will, into the virtual urgent care program. And then there were 2,195 encounters, actual telehealth encounters within the program. They looked at 4 quarters of data, so this represents 4 quarters of data, and zip codes were the unit of analysis. And by the unit of analysis, they're looking at the determination of rural versus and they used the zip code to determine that rural versus urban classification. The conclusion was the study concluded that patients facing inequities from rural areas were enabled better healthcare access by utilizing the virtual urgent care program. And this is small, I know, but it's colorful, so it's nice to look at. But let me just walk you through, even though you can't read it. Probably. So this chart here in the lower left, the orange is percent urban, and the blue is percent rural. And these 0 to 11 numbers are, each one of these is what they call a component threshold of what do they call it? I can't remember now. I can't remember what they call it. I'm drawing a blank all of a sudden. But the categories of burden were so populations of American Indian, or so a zip code coming back to me. So you had the authors looked at to define. So to define, I'm going to use the word burden, but I think they used a different inequity. They used the term inequity. So to define inequity, a zip code had to have at least one area of inequity. So that is either they had an American Indian population, African American population, There was a threshold of poverty level, single female, head of household, Medicare recipients, Medicaid recipients, health services access, road access, broadband access, and no vehicles. So based on those thresholds, if you had none of those in your zip code, and I'm using none broadly, on this chart, you were 0 on the left-hand side. If you had all 11 of them, you're on the right-hand side. So what's shown in this particular chart is that for the population they were looking at, the bulk of the population that had none or very few of these health inequity factors was largely in the urban areas. And then when you went to the rural areas, a greater percentage of the population had more than one of these health inequity factors. The chart here on the lower left looks at the penetration of the virtual urgent care program based on those inequity factors. And you can see that for each color is a separate quarter, and the black is just a cumulative. But you can see the colors progressing over time, showing that for any of these inequities or any of the zip codes that had these inequities in them, the penetration of the virtual urgent care program continued to grow. So there was a positive trend on the use of the virtual urgent care program. The map up here looks at where the visits were occurring on the right in the brown, and then on the left, the areas of social and access inequity. So these are areas where there was inequity, the blue being the highest levels of inequity and the green being the lowest levels of inequity. Next article is by Phillips et al., and that's not me, it's a different Phillips. But health-related Google searches performed by parents of pediatric oncology patients. So this is looking at Google searches. Continuing to get, I guess, how people use and how people search for data and what kind of data they look for and when they look for it. So this isn't a study that looks at prediction. So we're not trying to predict anything based on searching behavior, which is a lot of what the research has been around Google in many cases. But this is just looking at what types of information and when the information is sought out by the parents of children with cancer online. And we described the parents' health-related Google searches, and they started looking 6 months before. So they were able to go in when someone was enrolled in the research, they were able to go in and look retroactively once they were given permission, look at retroactively 6 months in their Google search history, and then also go forward until the point when they enrolled in the program. So they were able to look post-diagnosis as well as pre-diagnosis. And the results were the parents searched for health-related topics more frequently than the general population, which is expected. But the idea is that this is an initial research study looking at how information is used and how information is gathered and what kinds of topics. So it's adding to that body of research. This is their kind of main findings in a pictorial way. If you look at the two big areas here that are in blue, it's number 10, the first column, and then the fourth column. Number 10 is care sites. So where care is given is a very heavily searched term or searched topic area. And then the other area that's about the fourth column over from the left is symptoms of disease. So the symptoms, and these are predicted. There's nothing really surprising that came out of this, other than I just wanted to show with you that people are looking at this, and this is the kinds of ways that they're looking at this data. Next study is by Redding et al. Visual analogies, not graphs, increase patients' comprehension of changes in their health status. So this talks about that. I had talked about visualization. So this is an example of one of the articles dealing with visualizations. And it's also an article dealing with patient-reported outcomes, so patient-generated data as well. and the interpretation of that data. So visualizing patient-reported outcomes longitudinally over time can help patients interpret and contextualize their own patient-reported outcomes. So that was the premise and the objective. The methods were, they had 4 different pictures. I'll just go to them real quickly. They look like this. I'll go back to that, of how information could be displayed. And the results were that, I'll just read this. I hate reading stuff, but I'm going to. So 63% correctly comprehended text only, 60% comprehended the line graph. And then you had greater comprehension for a visual analogy and a number line. But the interesting thing to me, which is why I picked this study out, is that it went a little bit beyond just comprehension. So of the participants who comprehended at least one condition, 14 preferred a condition that they did not comprehend. So individuals selected charts that they didn't understand. And one of the conclusions is we need to understand why that is. So why are people picking a chart where they don't understand it when they at least comprehended one of the conditions that they were looking at, if that makes sense. I think I said that right. So they were understanding the information in one way, but they liked how it was presented in a way that they didn't understand. And trying to get to the bottom of that was something they wanted to do in some future work. But I thought that was an interesting finding from the study. But these are the four chart types that they came up with. Chart B upper here in the right was the one that had the highest comprehension level. And then this A here had the lowest comprehension level. All right, now we're up to 2020-21. I should take a deep breath. So some of these these themes are repetitive, but these are the themes that came out from my review. And again, that's one of the limitations of this, is that this is solely my review. So I'm the one interpreting this, and I may be missing things. I may be interpreting things wrong, and not wrong, but I may be interpreting them differently than someone else would. So the themes from 2020-2021 were nursing workload. So that theme continued from 2019-2020. Use of machine learning and artificial intelligence as risk factors and predictive models, that's remained the same. Older adult use of e-health. Again, this is also remaining the same and continuing to grow, as I showed you on one of those topic trends. Information literacy, though, was a greater emphasis this year. So while we're looking at the use of e-health and probably more technology acceptance of e-health in 2019-2020, there was a lot more emphasis here on information literacy. So understanding the information that's there. So if you're going to have a mobile app, or you're going to have other kind of technology, what is the information literacy? How is that information perceived by the individual? Information resources, self-management, apps, so kind of self-care, self-management of your care using apps, assessment tools, EHR adoption in more places. There's more of an international feel to the literature as far as EHR adoption. These are the initial mentions of COVID-19. I expect more next year. Education articles were down. It's just kind of an aside. In the past several years, I've done this. I've rejected. I've cut out of I've excluded from the study a lot of articles around education. This particular year, there weren't a lot of them, so it was just an interesting trend that I jotted down. It being the 200th anniversary of Florence Nightingale's birthday, there were a lot of articles that addressed Florence Nightingale. They weren't necessarily research, but I just thought I'd make a note of that she was mentioned frequently throughout the literature in 2020, 2021. Informatics has become very broad. As I look at the literature, the types of things that are now being studied and are under the classification of informatics continues to get very broad. And I wanted to go back, and haven't had time to do it, and look at some of the definitions that are out there of informatics and see how well they fit and continue to fit with the kind of expansion of where informatics is growing. I think they do based on my initial look at it, but I think it's something that would be interesting to look at more deeply. And then I didn't see anything. I thought I would see stuff on security. Security has certainly become a big issue, but I didn't see any articles on security and information security. So I have a couple of studies to go over. But I thought I'd first start with just some of the foreign studies. I mentioned that I saw a trend of many more articles from foreign sources. So these are just some of the countries in no particular order or no particular reasoning per se to pick them out. But Iran, nurses' adoption of health information technology, nurses' attitudes toward telenursing and telehealth, and nursing informatics competencies. There were 3 studies from Iran. There were more, but there are 3 studies that dealt specifically with nursing adoption of health information technology and competencies. Germany is literacy, dealing with health technology literacy. In Brazil, we had sepsis detection algorithms. Kenya, we had social factors, and again, in the adoption of electronic health records. That was one of the themes that I talked about earlier about there's still a lot, technology acceptance is still a theme. If I was going to make a somewhat unscientific statement, that theme is trending more from the US to some of these other international settings. Turkey, nursing informatics competencies. Korea, adoption and implementation of SNOMED, mobile personal health systems. Greece, perceptions about big data technology. Finland, roles of healthcare leaders. So a broad spectrum of topics across a broad spectrum of settings and locations. So the first specific article is by Fu, if I'm pronouncing it right. Usability Evaluation of 4 top-rated commercially available diabetes apps for adults with type 2 diabetes. And this goes back to that topic of how we use apps and this growing need to get apps that are going to try to change patient behavior. I talked in the prior year about financial incentives for behavior. Here's an app, or trying to evaluate apps that may impact patient behavior. So they examined here the usability of the app. And the finding was that of the 4 top-rated apps that they selected, 2 were marginally acceptable and 2 were completely unacceptable. So the specifics were that they had a D or an F, and I believe they used the system usability scale, which many of you are probably familiar with. But they basically got a D or an F, and there were no real good apps designed for patients. And so they said diabetes apps design should target patient motivation and incorporate key heuristic design principles. So their findings were that these apps aren't really following good design principles. It may have to do with who's designing them and who's implementing them. But we need to do a lot more work in how we design and implement apps for patient care. Next study is by Hyun, application of text mining to nursing text exploratory topic analysis. And here I had talked before about the CCR. Remember in 2019, 2020, I talked about a way of pulling out nursing documentation by looking at subject matter experts and trying to identify those terms that would be in the nursing documentation. This is a machine learning methodology that was used called topic modeling to identify topics or themes from the nursing notes to determine whether the text mining approach is suitable to gain meaningful summary from these notes. And they came up with 40 topics or themes. So the machine learning model, the machine learning methodology goes through the notes and tries to identify themes through an iterative process that's automated. and their particular process came up with 40 topics themes. And here's just an example of some of them. Topic 1, airway, cognitive, myocardial infarction, renal, etc. So these themes and the related collection terms, so the terms that then migrated to those themes are in the right-hand column here. But again, looking at machine learning and the kinds of things that, the kinds of studies that are going on, you're looking at various ways to get to the same bottom line, which is how can we interpret what's in these nursing notes to improve care. Next article is by Lynn. Clinical informatics accelerates health system adaptation to the COVID-19 pandemic. Examples from Colorado. This is there's nothing special here. This is a typical COVID article from this particular year. And a lot of these articles around informatics talk about how implementations and what kinds of, so they describe 14 examples of innovative and effective informatics interventions. So because of the impact of COVID on documentation, what are the things that were done from an informatics perspective to improve that, to help the situation? And this would be a typical, this was a typical study that was done, and they just talked about, in this case, they had, I think they came up 14, I forget how many they came up with. But their conclusion was informatics trained physicians and nurses drew upon their trusted relationships with multiple teams within the organization to create practical solutions for onboarding, clinical decision-making, telehealth, and predictive analytics. So it's almost a pat on the back for nurses and physician informaticians that they can take a crisis and come up with new ways to approach this. I believe we had a prior, if I'm remembering correctly, we had a prior educational, Mary, help me, what is it? I'm giving one of these now, educational program where we had someone talk about some of the innovations that were done as a result of COVID. So this is just another example of that. Next article is by Moore et al., a systematic review of the impact of health information technology on nurses' time. So I talked about documentation burden and stress. So this article looked at the impact of health information technology on nursing time. And they looked at a total of 1,647 articles in their initial systematic review. I talked about the increase in literature reviews. Here's an example of a literature review that addresses an important theme of the impact of health information technology on nursing time. They ended up with 33 articles that met their inclusion criteria, and they looked at the increase in time spent on documentation and the increase in time spent administering medications. So as expected, the increase of time spent in documentation went up 22 and 46%, depending on how the 33 articles calculated it. So they provided both numbers. And the time spent carrying out medication administration decreased by 33%. So the impact of electronic health records had kind of a bi-directional impact on documentation time, on nursing time. Their conclusion was many HIT systems resulted in nurses spending more time in direct care and evaluated activities. So they found from the literature that the net result is that the systems actually allowed nurses to spend more time in direct care and value-added activities. So I'd be curious of a reaction to people to that particular statement from this study. Next one also looks at nursing stress. This is by Po Yin Yen et al. Everyone who was at last two symposiums ago, Po Yin actually gave a presentation that was part of this work. So you've met the author on this particular study. But she does a lot of work looking at time motion. This is a time motion study looking at ERU usage and its effect on cognitive workload. So nurses' stress associated with nursing activities and electronic health records. data triangulation from continuous stress monitoring, perceived workload, and a time motion study. So the authors here actually had the nurses walking around with blood pressure cuffs as a measure of stress, and tracked in 4-hour blocks what nurses were doing and where they were during each of these 4-hour blocks. So instead of looking at it over a 12-hour period, they looked at it in 4-hour increments. And the results were that perceived workload was a strong predictor of nursing stress. And the key is perceived workload. So looking at the perception of workload, and there wasn't a direct measure per se of workload, but their perceived workload is a strong predictor of nursing stress and how they spent their time with patients. Again, there's higher perceived mental demand. And they use the word perceived a lot because of the tool they use to measure these things. It was a tool developed by NASA that measures 7 components. I can't remember what they are off the top of my head, 7 components of cognitive load. And it's their perception based on this, this tool. So higher perceived mental demand, physical demand. They received higher perceived mental demand and physical demand when they were assigned more patients, regardless of the patient acuity. So regardless of whether they were high acuity or low acuity patients, just the mere fact that they were assigned more patients increased stress and perceived mental demand. And then just a little addition here at the end. This is a chart that was in the study. The numbers in this column here represent minutes spent on a particular task. So the tasks are, the C's address communication tasks, H deal with hands-on tasks, and L deal with location tasks. So if you look at a 4-hour period, in this particular documentation here, you had 45 minutes of EHR documentation. You had 15 minutes of direct medication and 7 minutes of direct procedure time. 6% indirect get meds and 5 of handoff rounding. So the biggest amount of time was spent in the patient's room, followed by the nursing station time. And they were able to spend a certain amount of time with patients as well. So that's not exactly what I would have expected, given kind of what I've read in the past, but this is what they found looking at the kind of the time motion and tracking where people were in a given 4-hour block of time. So the last piece is up to you guys to have some kind of a discussion on what I presented. So I would welcome feedback, comments, questions. This is kind of a time to have a conversation about the studies and trends that are going on in nursing informatics. Is there anything in the chat? I haven't done a great job following along with the chat.
Well, first of all, Annie, thank you so much for doing this evening. Do you want to tell people how many articles you reviewed?
Well, I told them it's close to 2,000.
Which is pretty amazing. So thank you very much. I mean, it's just phenomenal. I was interested. It's just an observation. And I think it was your 2021 when you're looking at priorities, and nursing workload was one, and that makes a lot of sense. But I think it's interesting when you look at like the HIMSS leadership study. There wasn't a lot on like patient outcomes related to HIT or care coordination, which I'm really surprised about, unless that was buried into the nursing workload.
It could have been buried in there. If you're looking at specifically studies around patient outcomes, they were more buried in the predictive analytics and big data stuff, as far as being more able to predict patient outcomes as opposed to direct linkage from I think what you were talking about, direct linking from nursing stress or nursing time directly related to patient outcomes. So I didn't see that buried in the documentation burden literature, at least the literature that came up from here. I know there's literature out there on that, but I tried to stay true to the process and only look at the literature that came up. And I tried to focus only on literature that focused on nursing as well. I do know there's a lot of research on that particular question from the physician side. I did get enticed to look at a special edition of the JAMIA dealing with documentation burden. And I would say that the articles, almost all of them dealt with physician documentation burden.
Any other comments or observations from the group? I'd like to hear
Got
one
the
or two.
article on, I couldn't remember if that was like North Carolina or one of the southern states,
Yeah.
where you were showing it seemed different from the BMC study, because in the Boston area, it was an inner city study on, I without like pulling up the slide in front of me, but we had gone over that so much locally during COVID. Yeah, that. So, here right within Boston, we had inner city, they were surrounded by hospitals, and we still had people not getting care. And so there, it just kind of produced very different data because they could break it down to rural and city. So I thought that I was really fascinated by that study.
And keep in mind, this is pre-COVID too. So this map is from 2016 data.
Okay. Well, I think the BMC work was done pre-COVID, actually.
Yeah. Okay.
It was done on cardiac patients, diabetic patients.
Right. Okay. It's coming back to me. Yep.
Yeah. So, but it was very different, but it is a much, we don't have the rural thing. They were looking at access to care, and I'm sorry, I've got a little thing. Access to care and like where people live.
Right. Yeah. Yeah. So this adds that virtual telehealth piece to it.
Yeah. Yeah. Which I did like that.
Yeah.
Me too. Any other observations from the group?
I was very sad to see how the apps rated as very poor for people, because I know that a lot of my friends or, parents or friends or whatever were really looking for that for, especially diabetes or hypertension tracking, and that the apps did so poorly is, I find that very discouraging at the moment.
Yeah.
Definitely an area to be looked at.
Yeah, and that was consistent. I showed one study, but it was fairly consistent that the apps aren't doing what you want them to do. And I think part of the implication is who's designing them. These apps aren't coming from healthcare providers. These apps are coming from, for lack of a better word, teenagers trying to create apps. I'm over exaggerating. That's a complete exaggeration. That's unfair to say, but I think that's kind of the implication, is that we really need to take this more seriously. We can't just be throwing apps out there. We need to be serious about it if we really want these tools to work.
Definitely.
I'm kind of interested to see if we're going to see more research done on disparities, health inequities, especially with the Future of Nursing report. I remember going back to seeing a program about Healthy Chelsea, and when they won the Robert Wood Johnson Foundation Award. And it was so interesting. I got to talk to one of the managers, and she said they wouldn't have been able to win that award without the analytics that was provided by, I think it was MGH at the time. And I thought that was really interesting. So I'm curious to see if they'll, the marriage will come together, with this Future of Nursing report, the initiative, and if technology and informatics will be highlighted as a keystone of those initiatives. I'm not really hopeful, but I am hopeful. So I hope
I'm hopeful. I think that we will start seeing that. There were there were many articles that were rejected because they weren't studies, but they addressed health inequities and population health. So they were more opinion pieces, looking at the future and what kinds of things would be contributing to that. So to your point, Mary, how can we be using technologies to address health inequity? What kinds of research, what kinds of studies do we need to be doing to address that? So without actually having the studies, these editorials or opinion pieces were around, gee, this is what we really need to be thinking about and how we need to be thinking about it. So I would hope that those things would spur on research around health inequities.
Any other observations from the group tonight? I know it's hard late at night after everyone has worked a full day.
I just really appreciate the way you analyze like those first, I mean, it's nice to hear the articles too, because it's nice to hear what you think is, your kind of your favorites, but I love your analysis
Well,
at
thank you.
the beginning. It's really fun to see all that. So thank you for taking the time to do that. I know the reading is tough too, but or time consuming, but laying that out for us is that's a treat. So thank you, Andy.
My
Andy,
7-year-old
really
likes the
is.
colors.
When you listed the trends, were they in order by volume, or were they just, kind of what you?
There was no order to them.
Okay.
No, there was no order to them. It's somewhat hard to do that. The process I went through was, as I read the articles, I would keep a running list of things that would pop into my head as themes if I started seeing things a couple of times. I'd then go through the themes again and kind of reassure myself that those were things that I actually read. I'd go back to the pile of articles and see whether there were articles there that matched those themes that I could identify, so that I wanted to eliminate me reading too much into things. Because you can certainly read a lot of stuff, which I did, and walk away with a topic that isn't in the set of articles that you ended up with. You read 900 abstracts, all of a sudden you end up with a theme that's in those abstracts that's not necessarily in the final set of articles that were included in the study. So I tried to make sure I eliminated themes that were elsewhere, that might have been emphasized in a different way. But yeah, that was a long answer to your question. No, there was no ordering in those themes.
Do you think that with the new rule, like the information blocking or information sharing is really what it is, that will come up in your search criteria for the future? It's a new law that just went into effect in April. So
yeah, I think it will. I think we had a lot of research with the open notes work that was started, 10 years ago, at least at this point. There's a lot of information on patient-reported outcomes, which I think aren't quite quite the same. There was one article that was dead on to what you're talking about, Mary, that dealt with that information blocking issue, not directly related to information blocking, but it talked about if it was a situation where notes were going to be shared with patients, and they looked at how the nursing perceptions of see how they worded it. They worded it something along the lines of, they looked at how nurses documented differently based on what they believed the patient perceptions were of their health. If I said that correctly. So there was one article that talked to that, and it did trigger in my mind the information blocking that's going to be coming up. So I would imagine there would be some articles on that, but I don't think we'll see those until 2 years from now.
right.
I have one maybe final question if no one else has anything. Andy, if you had to give direction to the research community and say, based on your analysis the last 2 years, where would you like to see, either what wasn't covered that you would really like to see covered other than security, and would you give any direction or offer them any feedback based on what you've looked at in terms of the areas studied and the type of research done?
All right, there's no right answer to that, I hope.
It's an opinion.
I have some personal bias there, and that is that I like the concept of mental models. And these mental models are look at how people view and shape the world around them and make decisions. And I think we need to be doing a lot more in understanding how patients can empower their own care. So this whole concept of patient empowerment, I'd like to see a lot more research on. So anywhere from the apps that don't work to to the grocery store where we gave incentives for people to change, that didn't work either, to other ways that we're using this data to improve patient care. So wearables, watches, the machine learning and AI that's going to try to pull data out that's important, but marrying that data to behavior, I think, is going to be an interesting challenge as we go forward. But it's important. If we're going to improve health, we need to be able to impact patient behaviors. So to me, that is an important thing. But I have a personal bias to that a little bit.
Very neat. So I'll ask the group for one more question. And if there are none, we can wrap up this evening.
Thank you, everyone, for listening to me. I appreciate it.
I think one of the attendants concluded in the chat, and she said, "Andy, you are brilliant." And I think we should leave on that note.
Well, thank you.
Thank you very much.
Thank you
for
so
this
much.
Wonderful evening.